Tell everyone your name, please.
Dr. Ira Goodman.
Okay, and this is about your sister?
Yes.
Right, well, take us back and tell us the story.
Well, my sister was vaccine injured at age 2 from the original DTP vaccine. And this is a vaccine that was replaced with the DTP vaccine when they discovered that the original DTP vaccine, which was the subject of Vaccine Roulette, the movie, caused massive encephalitis in some of the children. And indeed, that's what happened to her. Her whole frontal lobe was destroyed, and she had a seizure. They brought her to the hospital, and of course, we didn't know it was vaccine related. They did what's called a pneumoencephalogram, which is a test where a barbaric test where they inject air into the spinal cord and goes to the brain, and then that's the only way they had to visualize the brain in the 50s. They didn't have MRI or CAT scan or anything like that. And they told my mother right on the spot that she would be brain damaged for life. But they didn't tell her why. And then in that same hospitalization, while she was in the hospital for a week or two, my brother got brought to the ER of that same hospital a couple of days later with stomach pains. He was only 5. Got diagnosed with acute leukemia. Sorry. You know, and he passed away about 6 months later. So my sister needed cradle-to-grave care, you know, from the age of 2 until she passed away 2 years ago at the age of 67. When my mother passed away in 2014, I got a lot of her records, you know, which weren't much, which included, I thought I'd bring this. This is my vaccine record from when I was born in 1949. I'm 75 now. And you see how few vaccinations I got. Then this is my sister's original medical records from 1955 and on. And you see the way the pediatricians kept these records in manila folders like this and with index cards. And each index card has, you know, probably 8 visits on one side, 8 visits on the other, a few notes. But they did record, as good soldiers would, every time they gave a vaccine. DTP number 1, DTP number 2, and, you know, and all the other vaccines. And, you know, it's painful going through these records and seeing how much they missed. They also missed, she had a very loud heart murmur that wasn't corrected until she was 30 because she became nonverbal, and it was difficult to determine, you know, exactly what her status was. So I'm coming here for 2 reasons. First of all, not many people have 70-year-old records to bring. And to see how profoundly it affected the family. I mean, this vaccine injury is nothing new. It's been going on for 70 or 80 years, as you know. But it's just at that time, we never suspected it was a vaccine injury, even though it happened around the same time in retrospect.
Now, your brother, do you have his records?
No, I was unable to get his records, but I think I know why he got leukemia. Because 6 months prior to his diagnosis, he developed boils on his scalp. And the pediatrician said, go get this over-the-counter product, XYZ, that was laced with benzine. And benzine is a known causative factor for leukemia. Now the research is out. And you get exposed to benzine as a child in the vulnerable time when your bone marrow is developing, you got leukemia. And he died 6 months later. So, but my sister survived. She was basically nonverbal, and, you know, went to an institution called the Young Adult Institute that did a wonderful job taking care of her. I mean, they were just
Can we show the people a
angel.
picture of her?
Yes. And this picture was taken during her bat mitzvah, which is a Jewish ceremony, and she was very proud to have studied. Could you imagine what it took for her to learn Hebrew and to, you know, say a few Hebrew words and go through that ceremony? She was about one of my favorite pictures of her. I guess she must have been maybe 45 or something like that when this happened. So, what else can I?
Well, so what do you want to tell the people? I think this is what, because
Well,
we're all learning from your experience and everybody's
right.
experience.
That number one, this is nothing new, and Pharma has been putting out dangerous products since day one. And my personal ethic is to never take any pharma product that has not been out on the market for at least 10 years. So you know the real data behind it. You cannot trust their studies. You cannot trust the FDA. You cannot trust the doctors that tell you to take it. When we first moved to San Diego, my son was about 10 years old, and we brought him to a pediatrician to establish a relationship with him. And we said we didn't want the vaccine. And this was 15 years ago, any vaccines. And he says, well, you can't be my patient. You have to have the vaccine. And you see this picture of my daughter, and they show a picture of a kid that was in intensive care, intubated with tubes, who died of measles encephalitis. So I said, well, was she vaccinated? Yes, she was vaccinated. But they just are closed-minded, and now they're completely captured by the governmental agencies. And it makes me sick to see physicians who should be able to read the literature to continue to spout the normal garbage about how vaccines are safe and effective. It's complete nonsense. I can't even look them in the eye. And then I've had other relatives take vaccines, even COVID vaccines, and neighbors. I mean, people just don't read. The only thing it takes to sell a product is to call it a vaccine. And you just label it a vaccine no matter what's in it. And and people say, oh, vaccines are good. And they're so inundated with this rhetoric that they can't see past that. They don't read. And physicians who should be able to read the literature, either one or two things are true of them. Either they know what's going on with vaccines, but they do it anyway because their job is dependent. They're immoral, or they're incompetent because they don't know and they don't bother to read the literature. Those are the two choices of people, physicians now. It's just terrible. And I'm a physician myself, and I'm sickened by how ignorant they are.
You said, are your children unvaccinated?
Excuse me?
Have your children had no vaccine?
I have one child.
No vaccine.
Well, I didn't know that much about vaccines. He got about half of them. Yeah. But we were in Arizona at the time, and we had a pediatrician that we liked. This was about 15 years ago, and I said, I don't want the measles vaccine. I don't want the chickenpox vaccine. He says, okay, it's up to you. They were completely easy about it. Now that would never happen. You'd have to have the vaccine, otherwise, whoever's watching them, paying them, would not allow you to refuse. You couldn't get other care, unless you got the vaccine. And my son graduated Brown University, and there were several vaccines that they wanted him to take, and we refused. And somehow, this was in 2017, they said, okay, but they put him in a separate room in the dorm. They gave him a single room in the dorm, which was actually a benefit, but they wouldn't give him a roommate because they knew that, they thought he'd be a danger to the other students somehow. Yeah.
I'm so glad you got those records there.
And if you want to put any of these on camera.
Yeah, well, maybe we'll have Brian here. Yeah, this is incredible.
Yeah. And my sister had other medical problems, including an atrial septal defect, and she had multiple bouts of sinusitis. In all, here's the Salk vaccine #1. I mean, that's the main reason they gave vaccines. She was getting every antibiotic known to man when she had multiple bouts of sinusitis. And I think that's because her immune system was compromised from the vaccine. She got the infections. They kept pouring antibiotics in her nose and in her mouth, and this probably disturbed the blood-brain barrier and could have contributed to her vaccine-injured brain.
Yeah.
But when you think about it, when I think about it, she could have had a life, she could have had a college education, she could have had a family and children. I could have had a brother-in-law and nieces and nephews, and her profession she could have had, and all of that's gone. from the shot given by the doctor, who we thought was the next closest thing to God at the time. I mean, he used to come over and with house calls to me and my brother, and we would fix up the house and clean the towels, and when I saw how respected he was by my mother, I decided to become a physician, and she was in touch with him for years. And I looked him up. I wanted to tell him, because I didn't know until 2014 when I saw these records what had happened.
How are we going to change this?
How am I going to change it?
How are we?
How
are we going to stop this?
I don't know. I mean, it's just people like you and Mary Holland and RFK Jr. And incidentally, when I was in 1966, when RFK Jr.'s father was a senator in New York, he wrote me a personal letter because I had written a cancer essay, and I gave him a copy of it in that Costa Mesa event.
That's pretty cool.
Yeah, he liked that. And so, how are we going to change this? What you're doing here, and more widespread knowledge, get press coverage if people are open to it, and try and educate the public. But I don't.
That's sponsored by Pfizer and Moderna.
Right,
That
exactly.
Press,
Yeah.
They're going to cover this.
Yeah.
Press,
They're never going to cover it. They wouldn't do a story like this. It's terrible. They're completely captured, and people don't understand it.
No, but we keep going and we keep trying.
Yeah, that's all you can do.
I'm sorry about your sister.
Thank you.
And your brother.
Yeah, and then a few years later, my father died of lung cancer when I was only 15, and my sister was 9. So my poor mother, had her job as a school teacher, had to support all of us somehow and keep it together, and there weren't the services that they have now. It was very limited. You can imagine what, and then the animosity from the neighbors and the prejudice we suffered, and the constant fighting with the caretakers, even up to her death, about getting her the care that she needed, and the AIDS, and it affected me profoundly. I almost didn't have children, even though I knew it wasn't genetic. I just was so traumatized by the whole thing. But we had a child, and he's great.
They didn't make her have any shots while she was in the place she was living?
No, I refused it. I made it very clear.
Didn't get the COVID?
No COVID shot. And she had COVID. But I wouldn't allow him getting the COVID shot. Nice. And but she had heart failure, and she had other issues.
Well, it's been brilliant listening to you, and thank you. This is what we've got to do: learn from what's happened to our families. So thank you. Anything else you want to say?
No, I appreciate all the work that you and Mary Holland are doing, and RFK Jr. I mean, I told RFK Jr. he's doing better work than even his uncle JFK or his father. I think it's more profound work and more important work than anything that they did on a global scale.
And this is why we love live streaming, because this is the people can say whatever they like. That's perfect.
Right.
Because Robert F. Kennedy Jr. is, of course, just reminding everybody, chairman on leave for Children's Health Defense.
Right.
Okay.
The fight for children's health has hit a turning point, and your support has brought us to this moment.
Robert F. Kennedy Jr.
pledged to find out what is driving the country's rise in autism.
Scientists are scared to ask the question.
This is an epidemic, and we need to find the causes, and we need to stop it.
Other issues PhD has been pushing for years are finally gaining mainstream traction.
The vaccine itself does have profound risk.
We are removing pharma members from FDA advisory committees.
We are working to change the federal fluoride recommendations.
Removing all petroleum-based food dyes.
We're going to change things for real this time.
This is the moment we've been fighting for. Please give today and help us make the most of this opportunity.